Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday, and this week's patient is Brandy Bledsoe. Brandy is a nurse practitioner that works in the field of pain management at Pain Consultants of East Tennessee. Welcome.
Thank you.
Have you ever gotten chiropractic care before?
I have not.
Okay. And what's going on with you here today?
About 2 weeks ago yesterday, I was at work, sitting for about 2 hours in one position, and I just got up and felt horrible muscle spasms tightening on both sides of my back, and it's just kind of progressed and continued over the last 2 weeks, and I'm continued with the muscle spasms, but also it feels like it's down in my sacroiliac joints, just a lot of tightness and stiffness and like a catching sensation in there.
Okay. All right. Well, I'm sorry that you're dealing with that. Is this the sort of thing that you see as a practitioner in your office?
We do. We often don't deal with patients as young as I am. Oftentimes we deal with more older patients who have more chronic conditions. A lot of times we'll get neurosurgical referrals for patients that are needing neurosurgery, but we do get our fair share of sacroiliac joint syndrome due to altered gait after a total knee replacement and things such as that.
Okay, so we looked through Brandy's x-ray, we did an initial physical examination, and what we saw was two things. Number one, bending over to try to touch her toes was very painful, not just during the bending over part, but during the standing back up part. And she had limitations in how well she could do that. So if you can't flex at your hips and flex through the spine, that's going to certainly be a problem. So we're going to see what we can do to help out with that. We also saw some discomfort during a squat, which a squat is just a loaded version of bending over. It involves hip flexion, so we want to see what we can do to help her out with that. With the x-ray, we did notice some rotation, some scoliosis in a few different segments, and that led to some issues with the alignment in the pelvis. So we're going to see what we can do to help out. If you're looking for a chiropractor near you, you can go to mobility-forlife.com and find a list of great recommended chiropractors in your neck of the woods. All right, so now I'm just going to feel around. We're doing what we call motion palpation, and I'm going to look for any restrictions in your thoracic spine that I think might be contributing to added movement imbalances in your lower back. And I'm feeling all sorts of stiff and tight spots. Do you feel what I'm talking about right there? Yep. So what I want to do is an adjustment to that. So an adjustment is just a mobilization where we isolate that particular segment that has restriction and see if we can't clear it up. And lots of times that helps to reduce the tone of the muscles in that area. All right. Get a breath. So take a nice deep breath and breathe out one more time for me. Good. Very good. And you felt that nice little release in the joint, but more importantly now, the motion of the joint and the tone of the muscle feels relaxed to me. Does it feel a little looser to you? Good. We see that lots of times where the thoracic spine is a huge contributing factor to added stress and movement dysfunction of the lower back and the pelvis. A little bit right there as well. All right, we're going to do one more deep breath. Breathe on out. Actually, I think I lied. There's a little bit more up here that I want to get to. So what I'm going to do is I will laterally flex your head over here, and the adjustment's going to be right there, okay? And that was fighting a little bit. Okay, I'm going to do some muscle tests here.
Okay.
And it's going to tell me what is working and what is not working so well about your low back, your pelvis, your hips, all that good stuff. Hip rotation's pretty good. I like that. Okay, so muscle test. So what I'm going to do is to push your leg down like that.
Okay.
And you're not going to let me do that.
Okay.
So resist. Ready? Go. Very strong. Other side. Pushing down right there. Don't let me do that. And again, that side's weaker. Would you agree?
Yeah.
Okay. So we're going to see what we can do to fix that. Turn. Okay. So your hamstring just tested weak, right? Right?
Yep.
Yeah.
Yes.
All right. And a lot of the innervation for your hamstring comes from the L5 and S1 nerve roots. Those L5, S1 nerve roots coming out of right here. Okay, so I'm going to take that segment and that's what I'm going to adjust. Okay, we're looking to create kind of a neurological reset on the motor control of the area. So take a deep breath, breathe on out. Very good. That doesn't always feel awesome in that moment. Go face down. Hold the leg right there. I'm going to push it down. Don't let me. You see the difference? There's an instant change, yes? Okay, now we're going to test your glutes. So raise your knee up towards the ceiling. Hold it up right there. And I'm going to push down. Resist that. Very strong. Bend here, knee up, pushing down. Very strong there as well. So now flip around on your back.
See that? Yeah.
Does that hurt?
It pulls.
Mm-hmm. That side moves a little bit easier, doesn't it?
Yeah.
Okay, so we're going to mobilize the hip capsule here a little bit. Drop your knee down over here. Good.
That feels good.
For us, a huge part of reducing the strain and stress on a low back or a pelvis is making sure the hips really move with
I
great
feel like
ease.
that's where I feel like my hip flexors are super weak.
Yeah.
Not necessarily weak, but stiff.
Okay. Well, we're about to test those. I'm going back over here. And we still, are you kind of resisting me a little bit?
No.
You feeling, how does that feel? Does it still hurt?
It's not terrible. I mean, it's a little uncomfortable. Now that does. That's more like just muscle soreness.
Right there.
My muscles just feel sore back in my back.
All right, so I'm going to do a little mobilization of that femur right there. I'm feeling restriction, certainly. So I'm going to bounce right there. Good. And now going into internal rotation. Much easier, yes?
Yeah, for sure.
Okay. Muscle test. I'm pushing your knee down that way. Resist that, okay? Ready? Nothing.
No.
And it hurt?
Well, a little.
One more time? Yeah, not great.
Yeah.
Other side. Pushing down, resist. Big imbalance, right?
Yeah.
All right, so turn back on your side this way. So L4, L3, and L2. Nice deep breath. Breathe out. Very good. Lay on your back. Holding that right there. Pushing down on your knee. Resist.
Wow.
A lot better, right? Okay.
Fine.
Raise up this arm like Superman and this leg like Superman. Good. Does that hurt?
No.
Other side. And
A little bit.
okay.
Like it's more my muscles just feel sore.
Now, our job is to create a situation where you have stability and control in your spine and your pelvis while having great movement in your hips. I'm going to check to see if you have stability with that.
Okay.
And what we're going to do is the non-painful one, so I believe it was raising up this arm and this leg, you're going to raise them up in a second.
Okay.
You're going to hold them up,
Okay.
and then I'm going to bully you around.
Okay.
There's two possible outcomes here. Number one, you have good control and stability. Kind of looks like this. Number two, you don't, and you'll fall over.
Okay.
Okay, so raise up this arm and this leg.
Which one?
this one and this leg. Hold it right there. And do we think we have stability here?
No.
Not so much. And do that cross crawl.
Same
Yeah.
Same arm and leg.
Mm-hmm. It's tough, isn't it?
Mm-hmm. Super tough.
But it doesn't hurt.
No.
And you are flexing and extending your hip. An exercise, the cross crawl, where you're on your hands and your knees, and I applied force from one direction,
Right.
and then you extended your shoulder and your opposite hip. What was that one like for you?
I was very surprising that when you did apply the pressure that I was able to do it with a lot
improved
more.
it.
Yeah.
Yeah.
Yeah. So that was surprising. Just how your different muscles, when you engage them, allows you to do different things with other parts of your body.
And that's one of our favorite ways of stimulating increased balance and control is actually pushing somebody off balance, and then you have to turn
To
on
resist.
your
Yeah.
exactly. And then the more you do that, your muscle memory becomes to where those are active muscles whenever you move your hips and your shoulders.
Right.
Great. Okay. So good. So we've gotten a little bit of stability and hip flexions. Good. So how we're going to do that is in the position you're in, kneel upright while you're still kneeling.
What do you mean?
So come forward like this.
Okay.
Good. And now, in that position, touch your butt back to your heels. No, your butt, not your hands.
Oh, sorry.
And back up. Good. Do it again. This time, don't touch my hand. Perfect. And again. Any pain, stiffness, discomfort?
No.
Good. You're in a 2/3 weight-bearing position, and you this is bending over. Good. And now, bring your right foot in front. And do the same sort of movement. Back a little bit and forward. Now that was a little tough probably on that left quad.
Yes.
So don't go so far and now forward. Good. So what you're just learning to do is shift your hips backward and shift them forward. And that's actually the strategy we're looking to accomplish. When you bend over to pick something up, your butt should shift backwards. And that way you're flexing through your hips and the strain is staying off of the spine. The hip hinge training, where we had you on your knees and you're kind of shifting your butt back as your spine naturally created a bent over type position, but really there wasn't any movement coming out of the spine at all. It was out through the hips.
Through the hips.
What was that like for you?
It was very enlightening as far as I've never, you always hear bend from your hips, don't bend your spine, but no one had ever really showed me what that looked like.
Yeah.
As far as hinging the hips backwards, I don't think I realized you really go that far back, which made a huge difference in the mobility and my ability to bend over. So
exactly. Yeah. I hear it all the time. It's lift with your back or lift with your knees. Lift it.
Yeah.
And all these are cockamamie things.
Yeah.
You actually do want to allow yourself to bend over during the movement. It's just that we want the movement coming from the hips, not from the spine, and not from the knees.
Right.
So this is how deadlifters lift 1,000 pounds.
Yeah.
You learn.
Because I've never done that before. I've always just bent.
Exactly.
I've never had that sensation of my hips going back that far and then bending.
Look how much better it feels.
Yeah, it feels much better.
Good. Okay, so that was our treatment. Brandy, how did that go for you?
It was good. I mean, it was and the adjustment wasn't nearly as scary as I thought it was going to be.
Okay, good.
But it was very beneficial. I felt like my mobility improved a great deal after the adjustments.
Awesome.
And I've been very pleasantly surprised at how well my back feels, and I think you've given me some good tools to be able to go home and try to get some of those muscles that I found out are weak strengthened, and I look forward to seeing you again.
Awesome, great. Well,
Yep.
thank you so much for being a
Thank
great
you.
sport.
It's good to see you.
It was very nice to meet you.
Yeah.
And don't forget to tune in next week for our next Treatment Tuesday. Again, this was Brandy Bledsoe from Pain Consultants of East Tennessee. I'm Dr. Scott Hoar. Don't forget to hit the like button, leave a comment below, and we'll see you next week for Treatment Tuesday. Bye-bye.